And so let's talk about the postpartum now, the recovery. I know you have a recovery program. So what are the most common complaints and how do you help these women?
Yes, so everybody's different. I will say that. Let's see, probably the most common complaints, number one, is just like the feeling like most of the people I get, they just feel like they don't have core control. Like I just can't connect to my abs, my back hurts. I don't feel like I can put the baby down without hurting myself, or that poor posture. You know, they're nursing all day, so neck pain, just other orthopedic concerns you probably have heard from your buddies. And then I see a lot that just pelvic floor weakness, where they just feel like they're just not ready to go run. They just feel heavy, or they have a cough and sneeze and stuff leaks out. And then the other big concern most people have, I think, is diastasis. So that separation, because that's such a hot topic now. But one of my, I don't necessarily think it's a favorite, but one of my favorites is pain with intercourse, because there's so many things and so much, like there's such a stigma around, like just go back at 6 weeks and it's supposed to be fine. And there's a lot of other things that I think we need to educate our moms on in terms of the healing process and the hormonal changes and tissue damage and just some of the things that we don't think happen or we forget, because baby's 6-8 weeks old and doctor's like, you're good to go. That, you know, just needs to all be addressed. It's just learning. It's the body's a system. I feel like I just get to play. I'm like, all right, let's see if this works. Let's see if this works. And just teaching them how to move. And I think a lot of my ladies, especially early, like 4 to 8 weeks postpartum, if I have seen them before, they know how I think. Or even if they followed me on Instagram, some of them just need that permission to move. And they're so fearful, kind of like you said with the prenatal stuff, they're so fearful to make themselves have a prolapse or, you know, and that fear manifests into more tension usually and more weakness, because we're avoiding the very things that get us better. And so a lot of times it's kind of going through and dispelling those myths that we kind of breeze through, and really giving them a safe place to talk about their birth story, whether that happened how they had hoped, because I find some of that is housed as like trauma and tension in the pelvis. So giving them a safe place just to unload and whether they're happy with their doctor or not, that's part of their healing too, is kind of going through some of that